Despite the pandemic, AM Best is maintaining its stable outlook for the U.S. health insurance industry. And while companies by and large were able to navigate the challenges, many remain in 2021 with the potential for new ones to emerge. Here to discuss AM Best annual review preview report on the U.S. health insurance industry is Sally Rosen, Senior Director, and Doniella Pliss, Director. And Sally, we're going to start with you. After the year of global pandemic, what is the financial condition of health insurers as they enter 2021?
Sure. Thank you, John. Health insurers have seen strengthening in risk-adjusted capitalization the past few years, largely related to the favorable earnings trend that has persisted. In 2020, health insurers reported record earnings, largely driven by the deferral of routine care and elective procedures that occurred in the spring of 2020, patients delaying care and treatment over concerns about exposure to the virus. As a result, risk-adjusted capital strengthened in 2020. I would note, though, that AM Best believes that 2020 and 2021 need to be looked at together. The earnings are expected to decline in 2021, driven by lower rate increases for the year, given the good, favorable experience, cost of administering the vaccine, pent-up demand, and the expectation for increased morbidity due to the delays in care.
Doniella, since the pandemic is ongoing, there's still plenty of uncertainty. What are the big questions for health insurers for this year?
As to be expected, most big questions are COVID-related. The main uncertainty, of course, when do things return to normal with less severe virus outbreaks, large share of population vaccinated, and possibly reaching herd immunity? But that leads to next questions. When does the utilization accelerate? How much of pent-up demand for medical services will emerge? And on the other hand, how much of missed treatment will never come back? For example, missed well visits and diagnostic testing only done once in a certain period of time are not coming back, but the volume of elective surgeries may very well be elevated in 2021. Overall, insurers have budgeted for higher claims volume in 2021. However, there is another unknown. How much does the morbidity deteriorate due to all the deferral of care in 2020? There is a good chance that the severity of claims will rise following a year of missed treatments and delayed diagnosis, especially for senior population. In addition, there is a potential of additional new cost from so-called long COVID, long-term complications from the virus, including both medical and mental health. All these questions are very much on the mind of the health insurance, and the answers will emerge as 2021 progresses.
Sally, was there anything regarding results or trends in 2020 that diverged from your initial expectations once the pandemic took hold?
Yes, there were several things, John. There was a widespread deferral of care that occurred in the spring for routine care and elective procedures as COVID cases were rising in both the Northeast and the West Coast, and the hospital systems were getting overwhelmed, as well as the PPE was becoming hard to come by. Additionally, individuals were reluctant to seek treatment over concerns about the exposure. Many of the people who have been diagnosed with COVID, a large percentage of them, are diagnosed with COVID and are isolating at home with minimal treatment. Many of those who are hospitalized are treated with oxygen, and only the most severe cases are being placed on a ventilator. Commercial enrollment was expected to decline due to the economic impact from COVID and the shutdowns. However, that was much less than expected, as many employees were furloughed with benefits due to some government initiatives like the Paycheck Protection Program, as opposed to being laid off. All of this led to record-setting earnings for the year.
Is there anything on the regulatory or legislative front, Doniella, that you think may have a sizable impact on the industry?
Yes, thank you, John. Majority of potential regulatory actions currently under consideration are likely to be beneficial to the industry, especially for carriers providing major medical product. The Biden administration has discussed providing more coverage and improved access to health insurance, including financial support. We have already seen some actions via executive orders that were signed in January that will provide special enrollment period for the federal health insurance exchanges in 2021. That can have positive impact on the enrollment. The administration is considering withdrawing previously approved waivers for work requirements under Medicaid program, which were put in place by the Trump administration. If this is implemented, it can keep more individuals eligible for Medicaid and would bring more stability to Medicaid enrollment. There has been discussion regarding increasing ACA subsidies and providing financial support to cover COBRA premium for individuals laid off during the pandemic, both of which would be favorable for the industry. Another important point, more recently, the Department of Justice notified the Supreme Court that it no longer considers the Affordable Care Act unconstitutional and is asking the court to uphold the law. The court decision is expecting sometime later in the year. However, for some of the supplemental products, specifically ACA exempt plans such as short-term medical coverage, there is a potential of not so favorable regulatory developments. President Biden has directed Health and Human Services to review these plans. These plans are not subject to the Affordable Care Act, require medical underwriting, and do not provide full comprehensive coverage. It is possible that we will see some agency regulations limiting the scope of these plans, reversing the Trump administration actions. Number of carriers realized significant premium growth from that particular segment over the past several years, and that can come under pressure.
Sally, should we expect any areas of growth for the industry?
John, for the last few years, we've seen growth in government programs, and that's a trend we expect to continue. We have the aging of the population, so we're seeing more individuals eligible for Medicare, and many of whom are electing Medicare Advantage and Medicare Supplement plans. And Medicare Advantage, in particular, offers comprehensive benefits at favorable price points for many seniors. We've seen enrollment in growth in Medicaid this year. I would note enrollment was declining in Medicaid in 2019 due to the stronger job market and unemployment rate. However, this reversed in 2020 due to COVID. The other thing that is currently aiding Medicaid enrollment is the Families First Coronavirus Relief Act. Increased the federal payments to states during the period of the public health emergency. And during that period, states cannot disenroll members. So as a result, you're seeing growth without anyone leaving the program.
Thanks, Sally. Doniella.
Thank you very much, John.
Thank you, John.
That was Sally Rosen, Senior Director, and Doniella Pliss, Director. You can find the full report online at ambest.com. For AM Best TV, I'm John Weber.